Before there was such a thing as a wildlife hospital, people had nowhere to bring an orphaned or an injured wild animal that they encountered. And as the population of the San Francisco Bay Area grew, people and wildlife were encountering each other more and more frequently. Wildcare itself began when people realized that there was a need for a wildlife hospital and an educational center that could provide environmental resources for people of all ages. The availability of professional wildlife medical care combined with environmental education, advocacy, and outreach means WildCare provides a real service for the people and the wildlife of our region and beyond. So ultimately, WildCare would hope to resolve all wildlife conflicts humanely and actually render our wildlife hospital obsolete through effective education, advocacy, and outreach. When people's awareness and appreciation of wildlife extends far enough to actually prevent animals from getting injured or orphaned in the first place, our medical care would no longer be necessary. That dream is unlikely to be realized anytime soon, unfortunately, so WildCare's goal is to continue to provide the very best possible care for our animal patients and the most innovative and far-reaching environmental education to the community. Expanding our facility to provide even better care and increased education capacity is a primary goal. WildCare's complete cycle of programs all work together to make the world a better place for humans and for wildlife. As one of the largest and best established wildlife hospitals in the country, WildCare's research data, our training materials, and our treatment protocols are in high demand. We are leaders in the field of wildlife medicine. Combined with that, our advocacy, outreach, and environmental education programs give people in the San Francisco Bay Area and beyond the powerful and truly effective resources they need to understand, appreciate, and live better with the wildlife around them. All of WildCare's programs benefit from our extensive knowledge and experience base and the excellent people that keep our programs running, including our large and very dedicated volunteer team. Whether partnering with the local Humane Society to bring us injured and orphaned wildlife, or collaborating with groups that provide education to underserved communities, sharing information, resources, and goals with other community organizations makes us more effective. Integrating all of our programs multiplies our impact and our effectiveness. Our approach makes it possible not only to give injured wildlife a second chance at life, but also to return it to a healthy and viable environment. To measure success, we track the number of education programs taught and the number of children reached. To determine if we're reaching the audiences that need our resources the most, we track how many scholarships were given and how many underserved schools received our programs. We know we're doing our work well when we see children returning to our programs again and again, and from positive feedback from parents and teachers. In the Wildlife Hospital, we track how many animals are treated and successfully released, and we compare year over year the survival rates of our patients. Our research and advocacy success is measured in research projects completed and advocacy issues successfully lobbied. Many people know WildCare solely by the way they first encountered us. If a person brought us a wildlife patient or called our 24-hour Living with Wildlife hotline, they know us only as a wildlife hospital. If our nature van naturalist did an education program in their child's classroom, or their child attended a summer nature camp, they know us as an environmental education program. People don't realize the true depth and breadth of WildCare's programs. WildCare has stayed true to our mission, providing education programs for thousands of individuals and treating thousands of wild animals every year, and the numbers continue to grow. In the 2007 Costco Busan oil spill in the San Francisco Bay, WildCare provided stabilizing care for over 20% of the affected wildlife. As a result, we were able to provide trained volunteers to help with the Deepwater Horizon spill in 2011. Our rodenticide diagnostics and advocacy program is a partnership with the EPA, the Humane Society, and the California Department of Pesticide Regulation, among others. This program uses testing of actual WildCare patients to quantify how widespread exposure to toxic rat poisons is among wild animals. One of the problems WildCare faces is that many of our patients are misunderstood or they're considered nuisance animals. Many people have negative connotations about skunks and raccoons, for instance. To genuinely provide a better world for both people and wildlife, our challenge is to educate about the value of these and other animals that people may fear or just not like. WildCare has also outgrown our current location in downtown San Rafael, California. Our programs can't grow without additional space for everything from cages and larger classrooms to desk space for additional staff and volunteers. With more resources, WildCare will be able to build a newer, better, larger facility with extensive caging on-site, multiple classrooms to expand our education programs, a larger museum, and interactive exhibits to make visiting our center even more educational. We'll be able to increase the scholarships we offer and expand our outreach to more underserved schools and communities. We will be able to continue to innovate in the fields of wildlife medicine and research and expand all of our program's scope. WildCare would like to expand our advocacy and environmental education efforts to encompass even more issues that affect the wildlife we treat every day. Currently, we do not have the capacity to treat large animals like coyotes, otters, and deer on site. Expanding our facility to treat and fully rehabilitate larger species from intake to release is a priority. Although we provide extensive stabilizing and transport services to wildlife in the event of an oil spill, we do not have the facilities to wash and dry oiled animals on site. Having that capability would expand our effectiveness in the event of a next oil spill.